Hello everyone, welcome to my video on Turner syndrome, a chromosomal abnormality. Let's begin. So, what is it? Turner syndrome with a 45X karyotype is the only monosomy compatible with life. Even in this situation, 98% of all fetuses with the syndrome are spontaneously aborted. Surviving patients have an unmistakable feminine appearance. Features of Turner syndrome may include a short neck with a webbed appearance, low hairline at the back of the neck, low set ears, hands and feet that are swollen or puffy at birth, and soft nails that turn upward. Short stature, widely spaced nipples, also called mammary hypertelorism. The frequency that Turner syndrome affects 50 per 100,000 females. Can boys have Turner syndrome? No, boys can't have Turner syndrome. However, the male gene SRY could be present in the X chromosome, causing masculinization. An XY male with mitotic failure causing 45X mosaicism can also occur. There is also evidence in cases of important deletions in the Y chromosome. The person may have a male phenotype with Turner syndrome characteristics, but does not meet the criteria for diagnosis. This is the classical representation of Turner syndrome with a single chromosome, but let's see some others. Causes. The most common karyotype in Turner syndrome is 45X, accounting for 40 to 50% of all cases of Turner syndrome, whereas 45X with 46XX or 45X with 47XXX mosaicism account for 20 to 30%. The remaining cases include Y chromosome variants and X chromosome structural abnormalities, such as isochromosome X short, uh, X long arm, deletion of the short arm or long arm, which can occur as mosaicism, and ring X, which is always mosaicism. There is also Y chromosome variants, which is always a mosaicism, where, for example, in this one, blue being 46XY and orange being 45X. Manifestations. Something I haven't mentioned in my videos yet is X chromosome inactivation. This happens in genetic females where the second X is inactivated and becomes a bar body, a condensed dot inside the nucleus of the cell. So, if in 46XX females, one chromosome is inactivated anyways, why do we have a syndrome if one X is missing? This is due to escape genes or genes are still expressed despite the chromosome being inactivated. So, if the chromosome is absent or the area where the escape genes are is missing, then we have Turner syndrome. One such gene is called the S-Hox gene. When one copy is absent, it causes short stature like in Turner syndrome. However, in other syndromes where there are multiple copies of S-Hox, more than the regular two, then we have increased height. We will cover these syndromes in the future. Turner syndrome has many issues in the reproductive system. First of all, we have hypogonadotropic hypogonadism, which is a condition where the hypothalamus or pituitary gland doesn't produce enough hormones to signal the ovaries to make sex hormones. In 95% of cases, they can have premature ovarian failure where the ovaries run out of eggs, so menstruation also stops. This can also be a cause of lower bone density because the sex hormones produced by the ovaries help sustain bone mineral density. It is thought that the mechanism in which premature ovarian failure happens is due to accelerated germ cell death. To understand what I'll say next, let's view the heart and analyze it a little first. The blue line is the normal path of the aorta. It has an arch where three branches come out of. Then it goes behind the heart to the lower body. Second, we have the aortic valve, which is supposed to be tricuspid, three parts of the valve. As for the cardiovascular system, congenital heart disease is present in approximately 50% of affected children and may include a bicuspid aortic valve, two valves instead of three, coarctation of the aorta, very narrow aorta, hypoplastic left heart syndrome. The left side of the heart is underdeveloped. This is the left side of the heart. Um, and aortic arteriopathy. This is the disease on the arteries that supply blood to the heart muscles. Over a lifetime, nearly 25% of individuals may develop an aortic aneurysm. Um, an aortic aneurysm is when the aortic walls are weak and they expand in a bulbous manner with a risk of rupture. The most common abnormalities include elongation of the aortic arch, an aberrant right subclavian artery, which means there's four branches coming out of the aorta versus the normal three. Skeletal abnormalities and impaired metabolic bone health. Girls with Turner syndrome often suffer from reduced bone density and delayed bone formation owing to estrogen deficiency during adolescence. Women with Turner syndrome have a 60% or more chance of having facial skeletal malformations, which include nyctognathia, which is a small jaw, and epicanthtic folds on the inner corner of the eye, high arch palate, and a low set ears. Madelung's wrist deformity, the where you can see a bump on the wrist. This is a congenital subluxation or dislocation of the ulnar distal end due to malformation of the bones. Forearm valgus, where if they put their arms in an anatomical position, forearms will angle away from the body at an angle 29% degrees or more. Increase sitting height to height ratio, where if the ratio where you sitting down and the ratio of you standing up is larger, so it's closer together. Um, and also a short fourth metacarpal, which means that your fourth knuckle will look a little bit more inside the hand and the finger will also appear shorter. We can have several diseases associated with Turner syndrome in the liver. We have steatosis, which is a fatty liver, steatohepatitis, which is a fatty liver with inflammation of the liver. Cirrhosis is scarring of the liver caused by chronic conditions like inflammation, biliary involvement. The liver produces bile and holds it in the gallbladder, which is in green. The connecting dots of the bile may be affected in Turner syndrome. Finally, nodular regenerative hyperplasia, which are small benign nodules without scarring that can cause portal hypertension. To understand the urinary tract abnormalities, I'll quickly explain the anatomy of it. First of all, we have the kidneys. They're the brownish structures. They filter blood and excrete urine. Then we have the ureters, which collect saved urine and take it to the bladder, which holds the urine until the person urinates. Kidney abnormalities are common in patients with Turner syndrome, with a prevalence of 33 to 70%, and include kidney and urinary tract abnormalities such as horseoe kidney, which are fused kidneys, renal aplasia, when one or both kidneys don't develop, double collecting system in one kidney, and abnormal ureter and urine regurgitation. Others, neurocognitive, strengths in verbal domains with impairments in visual, spatial, executive function, and emotion processing. Despite normal intelligence, girls with Turner syndrome frequently experience learning disabilities that may require specialized education and assessment. Increased risk of gonadoblastoma in individuals with Y chromosome material, metabolic disorders including central obesity, insulin resistance, type 1 and type 2 diabetes, and dyslipidemia. Hearing loss, both conductive and sensorineural. Hearing loss is common in patients with Turner syndrome with a prevalence of 63 to 70%, owing to chronic or recurrent otitis media. Sensorineural hearing loss underdeveloped semicircular canals and deformity of the auricle. Increased incidence of autoimmune conditions such as hypothyroidism and celiac disease. Diagnostics. Prenatal suspicion of Turner syndrome may arise when first trimester screening reveals findings such as low pregnancy associated plasma protein A, increased knuckle translucency, or abnormal ductus venosus flow. Diagnostic confirmation may be obtained through chorionic villus sampling or amniocentesis. However, the exact karyotype, especially in cases involving mosaicism, often remains uncertain if based solely on prenatal testing. For this reason, standard chromosome analysis using a peripheral blood sample after birth should be performed regardless of prenatal findings. In cases where mosaicism is present, a normal karyotype may occasionally be observed. Indications for testing to confirm Turner syndrome vary depending on the stage of life at the time of presentation. Karyotype analysis using peripheral blood mononuclear cells is the gold standard and is considered the first diagnostic step. During adolescence, patients may present with delayed onset of puberty or primary amenorrhea, elevated serum follicle stimulating hormone (FSH) levels support the diagnosis of Turner syndrome, whereas anti-Mullerian hormone may serve as a more sensitive marker for predictive ovarian insufficiency. Treatment and prognosis. Girls with Turner syndrome may go through growth hormone therapy to address short stature and estrogen replacement therapy to be able to develop sexual characteristics like breasts. Should they choose to become mothers, they can opt for in vitro fertilization and egg donation. Neuropsychological evaluation and counseling is recommended as soon as diagnosis is made to address psychosexual concerns, learning and educational challenges, and reproductive health. Their prognosis is relatively good compared to other chromosomal abnormalities, especially since they progress within neurotypical guidelines. However, they have triple mortality rate compared to the general population, and this is due to all the issues mentioned above. This means it's important that aside from the treatment I mentioned, individualized care according to each complication be made such as if they have a narrow aorta, they can get surgery to fix it, etc. I want to end this by saying that there are many foundations out there that help people with this syndrome, and many people get diagnosed in adulthood. If, after watching this video, you feel identified, I urge you to get genetic counseling. And remember, a diagnosis is not the end of the world, but the start of a new one. So, I want to give a shout out to the sources. First of all, I have Langman's Medical Embryology 15th edition. Also, the articles Turner Syndrome by Kessler and Organ Abnormalities Caused by Turner Syndrome by San Hoon Jun et al. And I also want to give credits to me, Camila Pimentel, for the drawings, editing, script, voiceover. Yes, Ibel for script clarity. Joanna Strange for the humanitarian approach review. My family and dogs for the moral support. And finally, you that's watching this video. Thank you so much for making it to this point. Um, if it's not too much problem, please subscribe, leave a like and a comment, and see you on the next time.